question and answer session. I think the first question is from the BBC, from Dominic Hughes. Dominic, please.
Yes, good afternoon. Questions mainly for Professor Powis, I think. How full are intensive care units in London and around the UK at the moment? Are there any hospitals that have run out of beds or are close to capacity? How many spare ventilator beds do we still have? And then on testing, has testing of NHS staff who are currently having to self-isolate, has that started now? How many tests have currently been done? Thanks.
So thank you very much. So on the question of ITU capacity, as you know, the NHS has been working incredibly hard to increase the capacity beyond the 4,000 or so beds that we typically have. And that has been pursued firstly in London, although work is going on all over the country, because as you are also aware, the infection has spread a bit quicker in London. So we are not at capacity yet within London, but beds are being opened all the time to produce that extra surge capacity. So in the first instance, we are using theatres and recovery areas. So those are areas in hospitals where anaesthetic machines, ventilators are already used for surgery and can be readily adapted to take critically ill patients. And that has already occurred. You may have seen some of that in London hospitals. And that's almost doubling the capacity that we have already. We are not using it at the moment, but clearly the number of patients is increasing each day, so we are expanding that capacity in advance. You will also see the plans at the NHS Nightingale in East London to initially bring on another 500 beds if they are needed. And we aim to get that up and ready for patients next week. So at the moment, I'm confident the capacity is there. We have not reached capacity, and I'm also confident that capacity is expanding, particularly in London, so that we keep ahead of increase in patient numbers.
Thank you.
And on the testing, as the Chief Executive of the NHS said yesterday, it is absolutely critical that we now begin to introduce testing for staff. And as I've said before, just to explain, that's really important for two reasons. Firstly, because if we have staff at home, either self-isolating themselves or in quarantine because a member of the family has symptoms, if it turns out that it's not because of coronavirus and we can bring that staff member back, that is really important for the workforce, particularly in critical areas such as critical care clinicians or emergency department clinicians. And those are the groups, paramedics as well, I should say, that we will be focusing on first. And secondly, because if they are positive, when they do come back, they can be confident they will have some immunity. And that will be really important going forward as we understand which parts of the workforce have had this virus and are therefore likely to be immune. So as Simon Stevens said yesterday, we are now beginning, as we ramp up testing, which we're doing all the time, to use that extra capacity over and above that which we need for patients to start to test NHS staff. So we're working with NHS organisations as I speak to ensure that that testing will be available over the next few days for their critical staff.
Thank you, Stephen. I think we move on to ITV. Paul Brandt. Paul.
Yeah, thank you, Business Secretary. Secretary of State, first of all, could you give us an update, please, on the health of the Prime Minister, the Health Secretary, and whether the Chief Medical Officer has now been tested for COVID-19? And to the Medical Director, if I may, given the number of deaths we've seen in the past couple of days, what hope is there that we're not on the same trajectory as countries like Italy? And given the rate of increase, can the NHS cope at this current level?
Paul, thank you very much for that. Well, as you heard yesterday in the press conference, the Prime Minister is showing mild symptoms. He continues to lead the government's effort in combating COVID-19. This morning he held a video conference call, and he will continue to lead right in the front on this. But I think the one thing this has reminded us is that no one is immune, and that is precisely why we ask people to follow the government advice in terms of staying at home, where they're absolutely able to do that. We want to make sure we protect the NHS and ultimately save lives. Stephen.
Yes, so clearly there has been a big increase in deaths today, and every death is tragic, and of course we need to do everything that we can to ensure that we don't lose the lives of loved ones to this terrible virus. But as Sir Patrick Vallance, I think the Chief Scientific Advisor to the government, said recently, if we can keep deaths below 20,000, we will have done very well in this epidemic. It's early, at the moment, and the scientists who are working with government to model what we can expect are, of course, adjusting their predictions now as we start to see the actuality of the epidemic in the UK rather than what we believe might have happened a few weeks ago. If we do reduce the deaths to a level which is below what we initially thought, I want to be absolutely clear, that won't be because we are somehow lucky. It won't be because somehow the virus is acting in this country differently from any other country. It will be because every citizen in this country, the British public, have complied with the instructions that the government has given based on the best scientific evidence to reduce the transmission of the disease. We can beat this virus, we can reduce the number of deaths, but only if we reduce the spread and the transmission. Now is not the time to be complacent. Now is the time to really, really lock down and hone down on what we've been asked to do. As I've said before, it's not somebody else's responsibility, it's all our responsibilities. If we are to ensure that we keep within NHS capacity, and of course, as I said earlier, we are extending capacity all the time, every one of us has a part to play, and we know that can work.
Great, thank you very much for that. The next question is from LBC, Ben Kentish. Ben.
Thank you, Ben Kentish, LBC. Secretary of State, you've told people to stay at home, but you've also